If your hair is getting thinner, the goal is not always to create new hair. Sometimes the goal is to wake up the hair you still have. That is where the stimulation bucket comes in. When people talk about hair loss treatment, they usually want one simple answer. What should I use to grow my hair back? But in reality, hair loss treatment do different jobs. Some treatments protect your hair from further damage. Hair transplants replace hair that is already gone. And some treatments stimulate weak, miniaturized hairs to grow thicker again. Today, we are talking about that third group, stimulation. Here is the easiest way to understand it. In androgenetic alopecia or genetic male hair loss, many hairs do not disappear immediately. Instead, they slowly become smaller. The hair shaft becomes thinner. The growth phase becomes shorter, and over time, the hair that used to provide coverage becomes too fine to visually cover the scalp. So stimulation treatments are not magic. They are not creating brand new follicles. They are trying to improve the performance of follicles that are still alive. Think of it like this. You're not planting a new tree. You're trying to make a struggling tree healthier, thicker, and stronger. That is why stimulation can improve hair caliber, density, and visual coverage. But here is the important part. This is also where many people get disappointed. Stimulation does not create new follicles. It does not completely rebuild a hairline that has been bald for years. And it does not always stop the underlying cause of hair loss. So if DHT is still damaging your follicle, stimulation alone may not be enough. This is why hair loss treatment often works best as a strategy, not as one random product. Now, the most famous stimulation treatment is Minoxidil. Topical Minoxidil has been used for decades. It is widely available. It has evidence behind it. And for many patients, it can help maintain or improve hair growth when used consistently. But there is another version that has become much more popular recently, low-dose oral minoxidil. This is not the same as just buying a foam or solution at the pharmacy. Oral minoxidil is a prescription medication. In many places, using it for hair loss is considered off-label. That does not automatically mean bad. It means it should be used carefully, with the right patient selection, the right dose, and medical supervision, because minoxidil can affect more than just scalp hair. Some people may notice unwanted facial or body hair. Some may experience swelling, lightheadedness, or changes related to blood pressure. So please do not treat it like a casual supplement. Here is the key takeaway. If your hair is thinning but the follicles are still active, stimulation can be very useful. If the area is already completely bald and shiny, stimulation alone is usually not enough. And if you're still actively losing hair, you may also need a treatment that addresses the cause, not just the thickness. So when I evaluate a patient, I do not just ask, what grows hair? I ask, what is still alive? What is miniaturized? What is already gone? And what is still progressing? That is how you choose the right treatment bucket. Protect, stimulate, or replace. And for many patients, the best plan uses more than one. So before you ask, what is the strongest hair growth treatment? Ask a better question. What job does my hair actually need right now?